program, we're turning our attention to health matters. Every story is unique. Every journey matters. That's the global theme for Breast Cancer Awareness Month this year. A reminder that behind every statistic is a mother, a sister, wife, or a friend facing one of life's toughest battles. Now, imagine this. Imagine 88 women in Nigeria will be diagnosed with breast cancer today. That's about 2,700 this month, and more than 32,000 new cases before the end of the year, according to the Global Cancer Observatory. For each of them, it begins with fear, confusion, and countless questions. Then reality hits. Treatment costs run between 2 to 30 million naira, not counting time lost from work, the emotional toll, or even the sacrifices that their families will have to make to keep hope alive. Just a few months ago, Nigeria's Coordinating Minister of Health, Professor Mohammed Pate, revealed that the country records 127,000 new cancer cases annually and about 80,000 deaths. He called it a national cancer emergency. But it's not all bad news. The federal government is reportedly supporting a groundbreaking study into a potential plant-based cure for brain cancer. The move, we understand, follows the discovery of a molecule extracted from a plant in northwestern Nigeria that has shown the ability to eliminate brain cancer cell within 48 hours at specific dosages. Particularly, it's targeting glioblastoma multiforme. It's considered one of the deadliest forms of brain cancer. There's also the cutting-edge treatment facilities like the Medserve LUTH Cancer Centre here in Lagos, considered West Africa's largest and best equipped. So today on Beyond the Headlines, we ask why more Nigerians are getting cancer. Why are so many still dying from it? And what can we do differently, from prevention to policy, to change this story? My guest is Dr. Mohammed Yakub Habeebu. He is the Chief Clinical Coordinator at the Medserve LUTH Cancer Centre here in Lagos. He joins me to unpack this growing crisis, and perhaps we can find some hope lying within. Dr. Habeeb, thank you for joining us.
Thank you for welcoming me.
A very sad story. I lost my mother-in-law to cancer stage 4 some years ago, and I saw real life the impact that this sickness has had on people. It practically just changes the life of the patient and everyone around them, especially the pain that they have to go through. So when you hear those numbers, the minister in July said 127,000 new cancer cases every year and 80,000 deaths. What comes to your mind? Are we dealing with a health crisis, or as he puts it, a national emergency?
Yeah, we are dealing with a national emergency. That number means more than that number to those involved. For every person that has breast cancer and has mortality from breast cancer, it's not only affecting that patient that died. It's going to affect everybody around that patient. So the toll is number. Absolutely,
it is. Breast cancer alone accounts for more than 32,000 cases this year. Why are we seeing this rate, though? Is it a lifestyle issue?
Lifestyle is very important. However, also we are diagnosing it early because we have better facilities to diagnose it. Those that would have been missed, we are now diagnosing it. And the toll is this high because they present late. People don't go for screening, and even after diagnosis, there are a lot of myths around it. That chemo, kills, that is caused by witchcraft and should be treated spiritually and all sorts. And also economic importance. We pay out of pocket. You have to do investigation out of pocket. So for patients to present early, you also need insurance, health insurance. If patients can go for screening free, rely on insurance rather than paying out of pocket, and can go for treatment, they will present early. And even if the number of incidents is high, we will be able to do better treatment because they would have presented early and they could have been cured. So the number of mortality will not be this high.
You really don't think that cancer is a spiritual problem?
Well, as an oncologist, I don't study spirituality. So what I just know is that the treatment is
Yes.
we know the treatment. So we know that it's not by prayer you cure cancer. You have to come for the real treatment, which is the chemotherapy, the radiotherapy, surgery, and targeted therapy, and at times hormonal therapy, not spiritual.
Is it a death sentence?
Cancer is not a death sentence. In the other world, that's in the high income country world, that's in the West, a lot of cancer patients are cured. And in Medserve, we are turning the tide. We are seeing patients presenting earlier than before, and we have patients that have been cured.
So what are the chances of survival in Nigeria? Leave the West out of this.
Okay. Now, 75% of breast cancer cases, they come in stage 3 and stage 4, making it very difficult to cure. But for those who present at stage 1, that's very early, the chances of cure in 5 years is almost 100%.
So most women come in too late.
Yes.
Often at stage 3 or 4.
Or 4, yes.
Why do we keep missing early detection despite all the awareness campaigns?
One, we are not doing screening the way we should, partly due to the cost of doing it, partly due to fear, and partly due to the belief that it is spiritually linked. And most of those that are diagnosed early, they also have barriers to accessing treatment. Barriers including beliefs that is spiritual, barriers like finance, because they have to pay to, then the facilities are not enough. We have very few, we don't have up to 10 functional facilities in this country, a country of over 230 million. So the distance to accessing the facility is also a big barrier. So we have to reform all this to have patients that are diagnosed come for treatment early.
So screening is what you do when you start seeing symptoms, or is it like a regular
Screening
check?
is what you do before you even see symptoms. It's a regular check. We have for breast cancer, for example, we have what we call breast self-examination, where a lady examines her own breast, is taught how to examine the breast, using the right hand to examine the left breast and the axilla or armpit, and then the left to do for the right. At a particular time of her menses, usually the 10th day of the menstrual cycle. So she does that regularly. However, we also have clinical breast examination, where the lady will go to a clinician, either a nurse or a doctor, who is better in doing this, this assessment. So that can also be done maybe once in 6 months or once in a year. Then you have the imaging, where a lady will go for either ultrasound scan or mammogram. And these are more advanced. So this can pick up the lesions earlier, and then treatment follows suit. And when treatment follows suit at this level, cure is almost guaranteed. But when you start having symptoms, signs and symptoms, especially pain, that means the stage is rising. That's maybe it's going to stage 2, stage 3, because the pain is as a result of invasion of the surrounding structure. So by the time you now see a big lump, usually when you investigate further, they might be spread. That's stage 4. So it becomes difficult to cure. So it's the screening that's done even before you have symptoms that helps diagnose it early, and then you come for prompt treatment, then it's most likely going to be cured.
Periodically we hear governments conduct free screening for,
Yes.
people, but it is actually not enough.
No, it's a
And
drop
I'm wondering
it's a drop in the
how much it costs to actually go for screening, for an average Nigerian.
Well, screening, the cost will depend on where you go to.
Okay.
If you go to a government hospital, the price is most likely going to be less than if you go to
private
private.
hospital.
And then you at times have some NGOs that also do screening. They
Hold that
get
thought for
money.
a minute.
Yeah.
We're due for a break, and it's an interesting conversation. When we return, we'll probe further. Stay with us, everyone.
Lagos to the world. TVC Communications has been nominated for its very first international award, the prestigious AIB. It's a recognition of our voice, vision, innovation, and relentless drive to push beyond boundaries. TVC Communications, Nigerian excellence on the world stage.
Thanks for staying with us, everyone. Dr. Mohammed Habeebu is Chief Clinical Coordinator at the Medserve LUTH Cancer Centre. Thank you for staying the course on the program this evening. So let's talk about what happens after a diagnosis, right? You hear stories of women selling properties, losing their jobs just to stay alive. Why is cancer care so expensive in Nigeria, and what are we supposed to be doing about it?
Yes, cancer care is very expensive in Nigeria. I would say the actual cost is not as expensive as it is in the modern world. However, what makes it very expensive is because we are paying out of pocket. So all we need to do is to have an insurance, a robust insurance, and then we will pay little, we contribute little into the insurance, and then the insurance will handle the care. Then it comes free to the patient.
And you're placing that squarely on the shoulder of government, right? Well,
not necessarily government alone. Government can initiate it, but we can also have corporate organization.
But we have NHIS. How far is that going?
Well, government actually has a CAP program, which is a chemotherapy access program.
Because many of the HMO that we have, I don't think they cover for cancer
most
care.
of them don't. Most of them don't. A few do. And those who do, most of them are being assessed only by the elite who will afford it themselves. So we don't have a robust insurance yet that is covering the treatment of
precisely. How can we fix that? That's what I'm talking about. Like, okay, if it's not government, is a private organization, is it that we have to pay more from our salaries? Precisely, what do you think can change?
I think there should be a policy on ground. A government should make the policy, and then that policy should be driven. For example, I always use this example. I can't remember the last time I assessed insurance fee for maintaining my car, but we all have to pay insurance fee. We all have to pay, having at least a third-party insurance for a car, but most of us don't assess it. So we can also have a policy that will drive people to, pay for health insurance that can cover, medical bills for cancer.
Medical practitioners like yourself have been an advocate for prevention. So walk us through the simple, realistic lifestyle changes that can reduce cancer risk for Nigerians, especially among women.
Especially among women, sedentary lifestyle has to be changed. We have to consciously imbibe exercise, regular exercise, because sedentary lifestyle is one major factor that drives malignancy. Also, alcohol, intake of alcohol, whichever one, whether it is the local, one or the...
Is it excessive intake?
It's excessive intake. It is said to be excessive intake. However, no alcohol is still better than whichever alcohol. Then cigarette smoking. Then diet. Our diet today is more of refined food. Most people are now on either spaghetti, noodles, or even fast food, burger and all that. All these food are highly refined. We need to take food.
So why is, what's this agency, why is NAFDAC approving noodles and spaghetti?
No.
If you are suggesting that
I'm not suggesting
it is causing cancer.
I'm not suggesting they stop. I'm suggesting that you don't make it the staple food. We also take bulky
for our own. So you're saying excessive consumption of noodles can cause cancer?
Not necessarily noodles, highly refined, diet. Noodle is just an example. I'm not saying noodles direct. I'm saying that once you are taking highly refined food as your staple food, and you are taking food that are preserved with chemicals, like the canned food, as your major, food, and then that will predispose.
Rice is staple food. Is it considered highly refined?
No, rice is not. Rice is grown.
Okay.
I mean, food manufactured, not grown. And then fatty food, especially for breast cancer, fatty food, because fats also predisposed to, breast cancer. Obesity also predisposed to cancer. And then breastfeeding is very important. Breastfeeding after childbirth protects the breast from, breast cancer. At least a year or two following childbirth, if you there should be breastfeeding. This will also protect, the breast from breast cancer.
October every year is Breast Awareness Month.
Yeah.
We've been hearing a lot of government functionaries talk about that. We have also taken a break from political conversation today to discuss breast cancer. But beyond wearing pink ribbons, what should women actually do this month? What steps can they, can help catch cancer early? Every
woman should start now, should go for screening. Every woman should learn how to do self-breast examination. Every woman should have where she does clinical breast examination. Every woman should start doing exercise, regular exercise. And every woman should watch what she eats.
And that applies to men as well, right?
Well, men, it applies to men, but not for breast cancer. Because actually, for 100 patients that has breast cancer, only 1 will be a man. 99 will be a woman.
Well, what's the most common for men?
For men is prostate cancer.
So what should men do different?
PSA. You should check your PSA once you are up to 40 years. You should start checking your PSA. PSA is prostate-specific antigen. Okay. It's a chemical in the blood that goes up when anything happens to the prostate, be it cancer, be it hypertrophy, which is enlargement, or be it infection of the prostate. So if you see, do this test regularly and you see it skyrocketing beyond 4, maybe like 10, then you do further investigations to, ascertain what is wrong with the prostate.
So I'm taking you back to the myths, the idea that cancer is a spiritual problem. We're very religious in Nigeria. Yes. And if you get a cancer diagnosis, the first thing you want to do is pray. Yeah. I mean, realistically, you probably go to church or mosque.
Yes.
And you seek spiritual help.
Exactly.
There are some who have also said that biopsy spreads cancer. How much do these beliefs still affect treatment-seeking behavior? That's one part of the question. The other part is the moment you start treatment, because that might also be a challenge because of how expensive the process is. Some start chemo and then they cannot see it through. It seems that the moment you start treatment, it gets worse, especially if you're not able to follow through.
Okay, now, for patients who start treatment late, they are already weakened before or fatigued before they start treatment. And most of the time, the aim of the treatment then is to either prolong life or to improve, clinically the well-being. But these are the patients that you hear their news when they pass on. Those that present early, they are treated and they get cured, but they won't come out to tell you they had cancer because of the stigma. So people don't know about them. So for most of the time, what you hear is the patient that passed on. You don't hear the one that is successful. And we have a lot of patients that have been treated that are successful. Even we have dignitaries that comes out to tell you that they've had cancer so years. But
is it accurate to say that they're most likely rich people?
Not necessarily. It's when you present early. The rich people, they still present late most of the time. Then, regarding spirituality, I always say that you can pray to have good information, for God to direct you, but you must still follow direction. After all, nobody prays and stay at home for money to come. You have to go and work and pray that you get paid. So prayer is important, but prayer should not take the place of treatment.
So the federal government is backing what it's called a groundbreaking study into a potential plant-based cure for brain cancer. They say that there is a plant component in northern Nigeria that can heal brain cancer in 24 hours. 48 hours. Why are we sleeping on that? We should bring it out at the snap of a finger.
Well, clinical trials takes years. So when we have something like this, we'll conduct a clinical trial. It could take several years before you eventually come out to say, this is what it is. So it's something that there are processes, because you are going to go stage 1, stage 2, like that, up to stage 4. So we're going to try it on the cells. You are going to try it on a limited number of people. You are going to try to see the side effects before you try it on the bigger population. So it takes time.
You mentioned earlier that the centers are limited, right?
Yeah, centers are limited.
I can assume that Medserve is probably overstretched, is it?
Well, Medserve is capable. We have the highest number of oncologists. We have medical physicists, we have oncology nurses, well trained because we started with expatriate. We worked with expatriate at the beginning, and we still have collaboration with centers in the developed world that we work with. Medserve has seen over 13,000 patients within 6 years. That, I believe, is, to the best of my knowledge, is more than the
What's
number
the survival rate of that figure?
Of that figure?
Yes.
Yeah, that figure encompasses all stage.
Oh, okay.
So we cannot say survival rate of the figure because there are different stages. And like I said earlier, most of the stages are between 3 and 4. We might not be able to cure them, but we'll achieve prolongation of their lifetime. You understand? We'll extend that day they will go.
So there's a stage at which cancer gets that is uncurable.
Yes, there's a stage at which you get that the probability, stage 4 is probably incurable.
What about 3?
Even 3 is probably incurable, but they may live longer than stage 4.
By virtue of the quality of care that they get.
Yes.
I would like us to, because we run out of time, about 2 more minutes to go, how do we bridge that gap in our country's cancer treatment? Are there, in terms of patient care, outcomes, research, what lessons that we can learn from centers like yours?
Well, the magic will be to have health insurance. We need concerted effort. There are many things that needs to be done, but once we have health insurance and patients, they believe that when they come, they'll be treated, they will come. And when they come at earlier stage, we'll start to see good prognosis, good outcome. And good outcome will advertise the place for other patients to come. So the most important thing here is to have that health insurance. If you have health insurance, apart from government establishing centers, I'm sure other private organizations will establish because there will be access to fund to treat the patients.
All right. So if we get health insurance coverage for a lot of people, it will cover for early detection, affordable care,
for screening, for treatment, screening and treatment.
No doubt every step counts towards saving lives. We hope that critical government stakeholders are paying keen attention, and they are also finding how to spend the lot of money they say we are making from revenue. I mean, this is a very good way to channel it. Dr. Mohammed Yakub Habeebu is Chief Clinical Coordinator at the Medserve LUTH Cancer Centre. Thank you so much for talking to us.
You're welcome.
That's our show today, everyone. Remember, you can watch it again at midnight and 6 a.m. tomorrow. I am Nifemi Oguntoye. See you at 7 p.m.